Hi, welcome back to the video. In this section, part 3, we're going to be discussing where does the inflammation come from. Well, all inflammation in the body comes from the immune system. Say, for example, you get a cold, a virus, a flu, a bacteria, something like that. Your immune system is going to become activated to kill off that infection. And that's a normal immune response. Another example of a normal immune response would be, let's say, for example, you step off a curb and you twist your ankle. When you twist your ankle, you damage tissues essentially. When you damage tissue, the immune system becomes activated to clean up that damaged or dead tissue. And in doing so, it creates inflammation. That's what causes your ankle to swell. But that's a normal immune response to an injury. To understand this, I'm going to take a couple of seconds to explain your immune system and how it works. Essentially, for this conversation, there's two parts to your immune system. There's your T cells, your Th1 system, and your B cells, your Th2 system. These systems are supposed to be in a state of balance inside the body. And let's just say I get a cold, okay, a bacteria or virus, a parasite, a yeast, a mold, a fungus, something gets inside of my body. Let's just say I get a cold virus. The virus gets into my body, and that virus is going to activate or stimulate a white blood cell. That white blood cell becomes stimulated and it begins to attack that pathogen. In doing so, it's going to release a chemical compound called a cytokine. It's basically a messenger protein that calls other white blood cells over to help join the fight. Those cytokines are what creates inflammation in our body. So as more and more cytokines get released from the white blood cells, our inflammation levels begin to go up. And just like when you have a cold or a flu, the more immune reaction, the more cytokines, the more inflammation, the worse your symptoms get. Okay, you can have a very mild cold or you can have a very major cold or flu, okay? And your symptoms vary based upon how much inflammation is present. That's a normal immune response. As your immune system starts to destroy that virus or parasite or that pathogen, whatever it is, your immune system response starts to come down, your cytokine levels come down, your inflammation levels come down, and you gradually start to feel better. That's a normal response. But what happens if that response becomes abnormal for whatever reason? Well, there's certain physiological stresses or stressors in our environment that can abnormally activate our immune systems, which leads to abnormally high amounts of systemic or chronic inflammation. These physiological stressors are physical stress, like falls or cuts or injuries, car accidents, physical illnesses, bacterial, viral, parasitic, fungal. Then you also have emotional stress, okay? Not to be funny, but let's face it, we live in America. This is one of the most stressful countries in the world. Most of us have families, we're married, we have children or grandchildren. These are all emotional stresses on our bodies, okay? We also have chemical stressors. Chemical stressors are different things in the environment, okay? Now, we can't control emotional or physical stresses, but we can control the chemical stresses, okay? Chemical stresses are things like environmental toxins, chemicals, herbicides, pesticides, solvents, food additives, okay? Those are chemicals. We also have things like heavy metals, okay? Heavy metals are the result of processing of everything in our environment, okay? We have chronic and hidden infections, which can also be a chemical stressor on the body, especially when they remain hidden for long periods of time, like Lyme disease or Epstein-Barr virus or CMV, cytomegalovirus. Those are considered chemical stresses on the body. We also have things like food sensitivities or food intolerances. And please don't confuse these with food allergies. Food allergies are very different. They're polar opposites. They're not even considered in this topic or in this discussion. Allergies are the result of an IgE reaction. Food allergies are they're known as an immediate immune response. They result in the release of histamine from the white blood cells. And histamines are what cause the symptomatology: stuffiness, congestion, itchiness, scratchy eyes, and tickling in the throat. Those are allergies. Food sensitivities and food intolerances are completely different. They're the result of IgG and IgA reactions. These are delayed immune responses that will take up to 72 hours. These reactions are going to result in cytokine production and release, which is going to, over time, result in increasing levels of inflammation. Okay? So allergies result in histamine and itchiness and scratchiness without inflammation. Sensitivities and intolerances result in cytokine production, inflammation without histamine and allergies. So we're looking at the inflammatory reactions due to foods, and these are food sensitivities and intolerances. And these chemicals and toxins and heavy metals and pesticides and food sensitivities and infections, these are called your body's toxic body burden. And your immune system is going to react to them in an attempt to basically destroy and get them out of the body or remove them from the body. But unfortunately, these things can't be destroyed. And this is going to result in an abnormally stimulated or an abnormally perpetuated immune reaction that's going to result in abnormally high amounts of inflammation that will persist and gradually increase over time. And this is what's called an autoimmune reaction. An autoimmune reaction is defined as a normal immune response against something that cannot or will not die, and therefore it continues to happen over a long period of time, which results in the massive production of cytokines, resulting in a massive amount of inflammation. And remember, it's the inflammation that's going to ultimately destroy and damage tissues, result in inflammation. The inflammation is also going to make you feel sick, okay? And it's really about, figuring out why that's happening, okay? What's causing all that inflammation? So, like I said, it's the inflammation that results that damages tissue and causes the symptomatology. If you can effectively figure out how to decrease or eliminate these toxic body burdens, we can allow for normal healing by the reduction of inflammation in our systems. Okay, remember, only a healthy body can heal, and a healthy body is a body without a high amount of inflammation. So if you can figure out and get rid of all the different toxic body burdens that are going on or present inside your body, you're going to effectively drop the immune response, drop cytokine levels, drop inflammation, allowing for normal healing and normal health to begin to occur. And that's what, again, this program is all about. Truly figuring out what's making you sick, okay? Remember, only a healthy body can heal. And remember, it's the inflammation that results from these abnormal immune responses that creates a system of unhealth or a system of disease, okay? So this, again, is the basis of our program, okay? It's about truly finding and figuring out what is inside your body that's triggering an abnormal immune response. Fortunately, there's only so many things that we can look at, or so many things that can do that. Heavy metals, environmental toxins, chemicals, hidden or persistent infections, and food sensitivities or intolerances. Again, your body can heal, but only if you let it, okay? High amounts of systemic inflammation hinder the body's ability to heal. Remember that example that I gave you about the fork on your skin. The more you scrape your skin with a fork, the more inflammation is caused. And I don't care how much Neosporin you put on it, it's never going to heal as long as you continue to irritate and cause inflammation with that fork. The first step in healing, I don't care what the condition is, the first step in normal, true healing is to stop the irritation, stop the inflammation. And with these types of health conditions, you need to be looking at those toxic body burdens, okay? The environmental toxins, the industrial chemicals, the heavy metals, herbicides and pesticides and food additives, chronic or persistent infections, and food allergies and sensitivities. Those are the main toxic body burdens that will abnormally trigger your immune system into an inflammatory state. So that's what the next topic or the next section of this video is all about. Figuring out which ones are present in you. Okay, so stay tuned. We're going to be right back with section 4. Thanks again. I'm Dr. Wilmich.